Hi, my name is Jessica, and I'm a nursing student in NU650. This is my um, head, neck, throat exam. This is my patient, Jose. Jose, do you give consent to be recorded today?
Yes.
And I give consent as well. Um, First, before we begin our exam, I'm gonna use hand sanitizer. Okay. So first, we're going to start with his general appearance. His general appearance is well appearing, no distress. He's appropriately dressed for the examination today. Um, I then am going to assess his head. His head appears symmetrical with no lumps, bumps, lesions, or drainage. Um, I am going to assess his skin. Um, can I feel your hands? So his skin is pale, warm, and dry. There is no lesions or lacerations or discolorations. Um, his skin appears intact with no excessive sweating. I then am going to move on to his nails. His nails appear with no clubbing, no cyanosis. His cap refill is less than 2. I am then going to move on to his hair. His hair appears full with no areas of hair loss. I'm going to palpate his hair. His hair feels smooth, soft. There are no flakes or scaling noted, no lumps or bumps. Um, Perfect. I'm then going to go on and move on to my head assessment. Do you feel any tenderness when I palpate your head?
No.
Good. So again, there are no lumps or bumps or tenderness noted. Um, I then am going to move on to his eyes, his eyebrows, his eyelashes, his eyelids. They all appear symmetrical with no loss of excessive lashes or eyebrows. There is no edema noted. There are no masses noted. I then am going to go on and assess his corneas and his lenses. There are no opacities noted. I'm going to pull down his lower lid. His conjunctiva appears pink. There are no redness. His sclera appears white. There is no yellowing. Again, there's no redness noted. Um, I then am going to assess his ocular movements. So if you can follow my finger with just your eyes. Perfect. There is no nystagmus noted or lid lag noted. I then am going to test his visual acuity with the Snellen chart. So the Snellen chart, I'm going to hold it about 6 feet away from him, and I'm going to have you close one eye, and I want you to read the lowest line that you can read.
EFTZ0.
Perfect. Now cover your other eye and read as low as you can.
EFTC0.
Perfect. So on the Snellen chart, he appears to be 20/30 for visual acuity. Um, so next we are going to move on to his pupillary accommodation to light. Now again, I don't have my pen light, so I am going to use the ophthalmoscope light to check his pupillary response to light. Just look straight ahead for me. Perfect. Perfect. So his pupils constrict with light. They are equal and reactive. So he has good accommodation. I'm then going to test his convergence. Can you look at this finger and follow it with just your eyes? Perfect. His pupils converge on my finger, which is great. We're going to do it one more time. I'm going to have you focus on my finger. and then look at the wall, and then look back at my finger. Perfect. His accommodation and convergence are good. We are then going to move on to the ophthalmoscope exam. I'm going to check for his red reflex and see what we can see. Ready? Oh, I see the red reflex. And I see the optic disc, the macula, the fovea, the retina. They are intact. There is no redness. There are no discolorations. And then we're going to check on this side. You see the red reflex, the optic disc, the retina, the fovea, and the macula. They are all intact on that side as well. Perfect. So we are going to move down to assess his nose. His nose is on inspection. It is symmetrical. There are no deformities noted. I'm then going to palpate for any foreign bodies. I do not feel any. I'm going to palpate his frontal sinus for any tenderness. If you feel any tenderness, please tell me. And his maxillary sinus, any tenderness?
No.
Perfect. All right. There is no drainage noted. There's no redness, lumps, or bumps. I am then going to test his olfactory function. I'm going to have you close your eyes and cover one nostril. I want you to tell me what you smell.
Vanilla.
Perfect. And you can switch nostrils. Keep your eyes closed. What do you smell?
Vanilla.
Perfect. And it is in fact vanilla that he is smelling. On that note, we are going to then inspect the nares. Perfect. And just tip your head just a tiny bit. Perfect. His mucosa appears pink. There are no lesions, no ulcers, no polyps. His septum appears with no deviation. And we're going to check the other side. Perfect. You see his mucosa is pink. There are no lesions, no ulcers, no polyps. There are no bleeding noted, no deviations in his septum. Okay, we are going to move on to the ears. The ears, I'm going to inspect the auricles on both sides for any lesions, lumps, drainage, dryness, scaling, which I do not see. Perfect, no lumps. And then I'm going to check in the ear canal. I do not see any cerumen buildup. I do not see any drainage, redness noted. And the other side, I do not see any cerumen, redness, or drainage noted. I am going to test his bone conduction and his lateralization of sound. I'm first going to do the Weber test. This tests lateralization of sound. So we are going to see if you hear better on one side or the other, or if you hear equal sounds. Okay, you let me know. Is it equal?
Equal.
Perfect. It is equal, he says. I then am going to test for air and bone conduction. That is the Rhine test. I'm going to test by doing two things. First is the air conduction. It will be A, and then bone conduction will be B. You tell me if, which one is louder to you. Okay. This is A, and this is B.
A.
Perfect. And I'm going to check the other side. This is A, and this is B.
A.
Perfect. So his air conduction is louder than his bone conduction, which is exactly what we would like. I am then going to test his hearing with the whisper test. I'm going to have you cover this ear, and I'm going to whisper a 2-syllable word and see if he can hear it. Baseball. Oh, I'm going to whisper it. Sorry. Baseball.
Baseball.
Perfect. And I'm going to have you cover the other ear.
Apple.
Perfect. So he confirmed baseball and apple, which is exactly what I said. The next thing I'm going to do is visualize the ear canal with my otoscope exam. So I'm going to pull the auricle up and back. Perfect. I see the tympanic membrane. It is pearly white. There is no bulging or redness noted. There is no cerumen. There are no lesions or drainage noted. I'm going to check the other ear. And again, pull the auricle up and back. And I see the tympanic membrane. It is pearly white. There is no bulging. There is no redness. There is no cerumen buildup. There is no lesions or drainage or bleeding noted. So I'm going to move on to the mouth exam. I'm going to inspect his lips. His lips appear pink. There's no cracks. There are no redness. There's no drainage. I'm going to have you open your mouth. Perfect. I'm going to pull down his lip. Again, his mucosa appears pink. It is moist, and his gums appear with no receding. I'm going to then take my ophthalmoscope and look in his mouth. You open up and stick your tongue out. Say ah.
Ah.
Perfect. So I can visualize the hard and the soft palate. The soft palate appears to rise and fall. I can see the uvula, the tonsils, the anterior and posterior pillars. They all appear intact. There is no lesions. There are no white patches. Perfect. And then we're going to move on to the neck assessment. So his neck appears symmetrical. His trachea appears midline. There are no deviations noted. Palpate his trachea. His trachea appears midline, as I said. I'm going to then feel for the thyroid. I'm going to deviate his trachea to one side. There are no lumps, bumps, lacerations. There are no scars on his neck. I'm going to deviate it to the right. There are no lumps, bumps, nodules noted. I then am going to assess it from the posterior side and have him swallow. Perfect. No lumps, bumps noted. I then am going to assess his lymph nodes. So we are going to assess periauricular. No lumps or bumps noted there. Postauricular. No lumps or bumps. Surface. Cervical. No lumps and bumps noted. The deep cervical noted. No lumps and bumps. The posterior cervical. No lumps and bumps noted. The supraclavicular, I'm going to have you turn to one side. Perfect. No lumps and bumps there. The other side. Perfect. No lumps and bumps. I'm going to come back up and assess his tonsillar lymph nodes. No lumps and bumps. The submandibular, again, no lumps or bumps. And then the submental, no lumps or bumps. That completes our head and neck assessment. And thank you. Thank you for watching. Thank you.